Awesome. Good morning, everyone. Welcome. I'm Meredith with Parkinson's Point, and today during our education session, we have Sarah Chen, and she's going to be joining us from Rusk University to share more about empowering ourselves with tools that can help us make the most out of our doctor's visit, as well as some other really important tips and tricks and great knowledge. Sarah, I'll hand it over to you.
Thank you so much, Meredith. And thanks for having me. As Meredith mentioned, I'm Sarah Chen. I'm a social worker at Rush in Chicago, and we're having a beautiful day here. So I hope everyone's enjoying the sun. We can be pretty informal. So if there's questions or things come up as we're going through the slides, don't hesitate to jump in and ask as they're coming up. But we'll talk a little bit about preparing for medical appointments, strategies for communication, and kind of anticipating the unexpected and navigating some challenges. And I may skip through some of these, just in an effort to be mindful of time. But as you think about preparing for medical appointments and kind of getting the most out of your appointment, we know that the doctors can be so busy and it can be really hard to get all of your questions answered. And thinking about a little bit of preparation ahead of your appointment can really help both you feel like you're a little bit more grounded, or like have a sense of what's important to you and what you want to focus on during your visit, as well as then helps focus the visit when you're with your provider. So things to think about would maybe be prioritizing some of your top concerns. And so, I think about, like, I've worked in the movement disorders clinic at Rush for the past 10 years and been in lots of patient appointments, and it can feel scattered at times, overwhelming. You can jump from topic to topic. And so having a sense of what your priorities are, or what is it that is most bothersome, most important that you want to make sure to talk about, having that in your mind as you go into the appointment can be really helpful then, as the doctor brings up other questions, and then you can kind of go off on other concerns or other things that are going on, but in the grand scheme of things, those may not be your top priorities. They may ask about, are you waking up often, frequently to go to the bathroom at night? And you may say, yeah, I am. It's annoying. I'm seeing a urologist for that. But that can kind of lead you down that path when in reality, you're worried about, is your medication lasting long enough between your doses? And that, you've spent time talking about the urinary frequency, which is bothersome. And I don't want to minimize that, but that's not your main priority. So kind of helping to think about what's most important, and writing down some of your questions so that you have those to reference, because you can walk into the appointment and feel like your brain has gone blank. So that can be really helpful. Even keeping a log of symptoms for a few days leading up to your appointment, just so that you have examples to reference. The doctor may ask you a question and you live with these symptoms every day, but is it a new symptom? Is it something that's been going on for a while? Is it something that the frequency has changed? And kind of being able to track a little bit for yourself too, to have that as a reference. Again, I've been in visits for myself, and they ask me a question and I'm like, well, shoot, I can't quite remember like how I've been feeling, or if this is something new. So writing that down can be really help you. And then thinking about anything that's changed, recent falls, trips to the ER or urgent care. Near falls can also be, if you weren't having near falls and now all of a sudden you're having more near falls, it's not a fall, but it's definitely a change. So kind of thinking about those things. Also thinking about, any other changes in your health. Did you get a new diagnosis? Did you just start a new medication? And sort of listing down any of those new medications or new or worsening symptoms. And then even, noting maybe at the last visit, they started a new medication, or they changed the schedule for your medicine. And after that, you noticed like, oh, my mouth is drier, or my nose is running more, or, I got this weird, like my hand, the color of my hands has changed a little bit. My fingers are more red, anything like that, new symptoms that could potentially be side effects, that you just kind of want to check out with the doctor. You can note those too as well. Helps you keep track of just what's going on. And then it might also be that in planning for the visit, you have a conversation with your family. Bringing someone along with you to the appointment can be really helpful. Another set of eyes and ears, someone else to keep notes about what's being talked about, help you keep focused on those priorities or the things you want to talk about. But then also having a conversation with that person, or maybe your adult child is coming with you and they're saying, Mom, I think it's really important that we talk about X, Y, and Z. Having some of those conversations ahead of the appointment too can make having, like, bringing up some tough things during the visit a little bit easier, because everybody's on the same page, or they're anticipating that this is going to be a conversation. So something to think about as well. Ideas about getting the most out of your appointment. Some of these may feel really obvious, but I think about here in Chicago, at least, getting to your appointment on time. Traffic and construction and things can be unpredictable. So giving yourself a little bit more time. We know that sometimes mornings can be harder. So if you have a morning appointment and you're a little bit slower in the morning, giving yourself a little bit of extra time to get ready. Bringing extra medications. So bring the dose if you might need a dose. Your appointment's at 9 and you have a 10 o'clock dose. Bring that 10 o'clock dose, but maybe bring the next dose too. Bring your 2 o'clock dose, just in case the doctor's running late, in case they want you to go do an extra test. Have those medicines with you. Bring a snack, bring some water with you. And then using those questions you prepared to help you stay focused and prioritize your concerns, being honest with the doctor and upfront about what's going on. It can be hard to think about maybe things that we're struggling with, or we're taking us a little bit more time, or are harder. And we may not always want to bring those up with the doctor, but if the doctor doesn't know what's going on for you, they don't have all the information to try to make an informed recommendation for you. So as the best that you can, trying to think about how to share what's going on. And if they're asking you questions or they're making recommendations and it's something that you're not completely understanding, ask clarifying questions. Ask them to explain it again. I'm sorry, I didn't quite understand. Or can you tell me a little bit more about why you're suggesting I do X, Y, or Z? Those can be really helpful. Both, maybe the doctor isn't doing a great job explaining it. So slow it down, pause, ask them to take another pass at explaining it. It also may help them kind of slow down too, and try to be a little bit more clear about what they're trying to communicate or why they're recommending what they're recommending. And you can have more of a conversation around that. What's important to you? How does this fit with kind of what you're comfortable with? Or if there's a piece of it that maybe you're not quite as comfortable with, getting the opportunity to ask more questions may either help you feel more comfortable with that recommendation or allow you to express your concern to the doctor so that then they can be more informed about what's important to you. And that may or may not shift their recommendation, but you've been able to have more of a conversation about what's going on. And then trying to be as calm as possible. The appointments can get overwhelming. They can get a little bit tense sometimes, or it can feel like you're maybe in the hot seat because they're asking all kinds of questions and you're being expected to kind of be able to answer all these questions, and that can feel really overwhelming. And so thinking about even being able to say, like, I think can we slow down for a minute, or give me a minute to think about that, or can we come back to that if you're having trouble with kind of the volume of questions that are coming your way. And that's where even sort of some of this preparation can be helpful, because you've done some of that pre-work ahead of time. And then even if everything goes out of your brain during the visit, you have your notes and you can rely on those. Thinking about taking notes, and like I was saying, consider having a support person come with you, both to be able to help back you up, reinforce what you're sharing with the doctor, but also to be there to, again, have another pair of ears to listen to what's being recommended or suggested. And that, like, then once you leave the visit, you have someone else that you can bounce questions or concerns off of. And then thinking about staying focused on around those 2 to 3 concerns that you might have. Like I was saying, a lot can get covered in a short period of time. And you may come sort of to the end of the visit and feel like, I don't know that we addressed my concerns. The doctor came in to the visit. I said, hi, it's nice to see you here. I have a few things I'd really like to focus on today. And you share your top priorities. And then you get towards the end of the visit and you're not sure if you got those things addressed. You can say, I'd like to make sure we address or before we wrap up, can we go back to my question? These phrases like this that you can be really helpful. They're polite, they're appropriate, but they're direct, and you're redirecting the conversation, demonstrating you really want this to be a collaborative process. This is really important to you, and you want to be a part of driving what's going on for your care. You can also think about, asking for next steps. Can you write down the specific medication schedule? How would you like me to make that adjustment? Can you write it down week by week for me? You want me to start with a half pill and then go to 1 time a day and then a half pill 2 times a day? Like, can you write all that out for me so I have that to reference? Or they're making a recommendation for you to go see a specialist. Okay, who would you recommend I see? Is there someone that you know of who's more familiar with Parkinson's disease, or, an atypical Parkinsonism or Lewy body dementia? Who would you recommend I go see? And if that doctor were to make a recommendation that I start a medicine, whether it's for urinary frequency or, a cardiologist, are there certain medications that you would feel comfortable with me starting? Because the last thing you want to do, it would be really frustrating if you wait the 3 months or whatever to get in to see the specialist. And then you see the specialist and they say, okay, well, I want to touch base with your neurologist before I make any recommendations about next steps. Well, shoot, now we've just delayed things more, and they're going to have to go back and forth between the neurologist and the cardiologist to figure out who, what everybody can agree on for a medication. Whereas if we can ask the doctor in that moment, if we think of it, write down the medications you'd feel comfortable with me starting. And then you can take the after visit summary or that note sheet that you get when you leave the office from your neurologist, take it to the cardiologist appointment, and they say, all right, well, I want to touch base with your neurologist. You can say, well, actually, my neurologist suggested like these were a few medicines they might be comfortable with me taking. Did these help? Does this help in any way in kind of you thinking about your next steps? And then you may be able to leave that cardiologist appointment with a plan. And they say, okay, yeah, actually one of the medicines I was thinking about is on this list. Here's how we might want to start in the next steps. And you can kind of take out some of that back and forth delay and care and frustration on your part to figure out, what do we even do? Like, more calls, more things to keep track of. So that can be really helpful as well. And some strategies for kind of thinking about communicating with your care team is this idea of self-advocacy, which can be really annoying because you have to keep telling your story, or there's an onus put on you to speak up and say, here's what I need, here's what's going on, here's why this is important, or here's what's bothering me. But the thing to think about in that is that your experience the best. The saying, like, if you know one person with Parkinson's disease, one person with Parkinson's disease, that everybody's symptoms and experience and progression can look so different. So even if the doctor or the nurse or the pharmacist say, oh yeah, I'm familiar with Parkinson's disease. Well, they may be familiar with it, but that may not resemble what your experience with Parkinson's disease looks like. So to be able to figure out kind of what's your short descriptor of what's going on for you, and you kind of pull that out and say, here are my symptoms, here's what's most bothersome to me, here's why, this is important to keep in mind as we make decisions around my care or next steps, or, primary care doctor, in your recommendation of vaccines, here's why maybe it would be important that I get those vaccines, but I don't get them all on the same day. I can be more sensitive, whatever the case may be. So thinking about, how you speak up for yourself, how you speak up for your loved ones, and how you continue to be able to advocate for what they need and what you need, so that the people caring for you are aware and can try to make choices and recommendations that align with what makes the most sense for you and your needs. And so a couple strategies for communication, a sense of like open communication, in the sense that, all of the care team members are communicating in a way so that everyone is fully informed and contributing their expertise to the decision-making process. So in the sense that like your pharmacist or your physical therapist or the cardiologist and the neurologist, they all come from different backgrounds and training. But this sense of like, what would the choice of a change in medication for maybe the cardiologist, how would that impact things? And why, from a neurologist perspective, yes, that we think that's important and that makes sense. And from you as the patient, who all of this, you're like at the center of all this communication, are you comfortable with making another medication change or adding a new medication, so that everybody's voices are being heard and considered, and in the ultimate decision that's happening. And one way to like foster active communication or open communication is a sense of active listening. So the sense of like listening with purpose, rather than that idea of like listening to respond, which there's a little bit of nuance in there, but I imagine you've probably been in conversations where the person you're speaking with like immediately has their response ready, and it may or may not be kind of reflective of what you've just shared or contributed to the conversation. It might be kind of coming from their agenda or the things they think are important to share, but may not necessarily feel like you may not necessarily feel like you've been heard or understood. And that so this idea of active listening is more of like, I've heard it described as a trampoline, where communication is bouncing off of one another, where one person is sharing something and then bounces to the other person is hearing it and then responding, and it bounces back, so that it's a more collaborative process and responsive to the other person. And so, that contributes to collaborative decision making, ultimately, that you as the patient are engaged in with your healthcare team to make informed decisions about the care that aligns with what's important to you, with the team's expertise, and so that can really then foster more engagement potentially. If the doctor is saying, I need you to go get a blood test, and you're like, I just got blood work 2 weeks ago at my primary care doctor. Why are you saying I need to go get another blood test today? Like, can't you just go look and see at the results from my blood test 2 weeks ago? But if there's a communication around it, if the doctor says, I potentially want to make an adjustment to your medication, but I don't know, I want to see kind of some of these blood levels first to see if it makes sense for us to make this change. And here's why I would think, making this change would make the most sense for us. I'm trying to address X, Y, and Z. Here's how we can, this medication choice might go about doing this. If there's more communication and engagement around a collaborative process, then you may say, okay, I don't love the fact that yet again, I'm going to go get blood taken, but I understand why this is being recommended, how this blood test is different from the blood test I did 2 weeks ago. And I am in agreement with the recommendation that the doctor is making. And so I'm willing to go get this blood test and move towards this potential like treatment change or modification. And so, it both improves your own buy-in, it improves outcomes, and it increases your engagement, sort of that buy-in engagement, that sense of like, all right, I'm a part of this process. This process isn't just happening to me or around me, but I'm involved in what's going on and the decisions that are being made. So thinking about kind of how it can sometimes feel intimidating to speak up during visits, or people can come in with an agenda, but how, as you speak up for yourself and tell your story, share what's important to you, that it can really be powerful to kind of both engage the doctors with you, and you can then be more involved in the decisions or recommendations that are being made. And so kind of also thinking about, as preparing for the appointments or recommended follow-ups, anticipating some of the unexpected, because we don't wish anyone to need to go to the hospital or have a surgery or have a unexpected hospital stay, but it is possible. It's possible that I could need that too. And so it's thinking about how can we anticipate a little of that, so that if the time came where we did have to visit the emergency room, we had a little bit prepared, and it was just, we took a little of the added stress off of our plate. And so thinking about, where do we keep an updated list of medications and a list of the doctors that we see, so that copies of any advanced directives, whether it's a power of attorney or a living will, kind of documenting what your preferences are for the type of care. Are those kind of clipped together and in a place that you can kind of grab and go? And some of that might be on the refrigerator, some of it might be in your email or a loved one's email, so that you can kind of pull some of that up, so that in the event of an emergency, you're not also digging to try to find these documents. You're not digging to try to find the power of attorney that you did 15 years ago. And if you're my mother, you put it in the safe place in her house, which used to be the bottom drawer of her buffet in the dining room, but she moved. And so honestly, I don't even know where she keeps it anymore, but I have an electronic copy of it. So I don't have to go digging around her house since she moved to try to find it. Thinking about, do you have maybe a bag of like clothes or extra phone charger, or some things that are just kind of gathered together, that in the event that you had to go quickly, you had a phone charger with you, or you have it in your car so that you can grab it and take it with you, so that you're not totally lost while you're sitting in the ER, or a book or something like that. Just little things that will take a little of that added stress off. The Parkinson's Foundation has the Hospital Aware and Care Kit. Lewy Body Dementia Association has the Diamond Lewy tool. And so even having those as tools to advocate with healthcare staff that may or may not be as familiar with Parkinson's disease or Lewy body dementia, for example. Cure PSP also has a booklet that the name is escaping me, around like what providers need to know, and then about each of the individual diagnoses. And so each of those can be really helpful tools that the providers in the ER may not be as familiar with multiple system atrophy. But if you can say, like, here's a one-pager that gives you just an overview of what you would need to know about MSA and how MSA is unique, and considerations to keep in mind, that can be really helpful, and you can like give it to the doctor, give it to the nurse, and they can look at it, read it really fast, and okay, we're not an expert, but we have more grounding, so that as we're making decisions or recommendations, we have this knowledge. And then thinking about, if there needs to be a hospitalization, this sense of self-advocacy, again, speaking up with the staff, whether or not they're familiar with LBD, Parkinson's disease, the atypical movement disorders, potentially having a family member with you or with your loved one during the hospitalization. I know that that may or may not be completely feasible, but think, hospitalizations can be chaotic with different staff, with shift changes, with the doctors coming in at random times that are unpredictable. And so if it's feasible to have someone there to help advocate if you aren't feeling your best, obviously, if you're in the hospital. And so having, again, another set of ears to hear what the recommendations are, or to say, like, before we start a new medication, I would really prefer if you would speak to my neurologist. Unfortunately, your outside neurologist, if they're not a part of the health system where you're hospitalized, they can't just call in and tell the floor staff or the doctor that's seeing you, like, here's what I would recommend. I don't quite understand the whole culture of the way things are organized, but it's the floor staff that needs to be the ones that are reaching out to your outside provider. If there's not a neurologist that's seeing you during hospitalization, you can ask for a consultation from neurology. You can say, I think it would be really helpful if a neurologist saw my loved one. I'd like to request a neurology consult. And so that can be really helpful too. That neurologist, again, it might be a general neurologist. They may not be an expert in Parkinson's disease, but they're going to be closer to it, and they may pick up and say, okay, yep, I think it's really important that we get a subspecialty. We get the movement disorders neurologist, or I'll follow up with your outside neurologist and we'll come up with a plan together. So just other layers that can help advocate for you. And then if there's certain medicines that are not recommended, for example, in Lewy body dementia, they really, there's certain types of medicine that don't play nicely, that people can have big side effects for. If the medicines like that can be listed as allergies in your medical record, and then that flags different things in the system. So like haloperidol, for example, is one of the medicines in Lewy body dementia that isn't necessarily recommended. If a doctor tried to order that because someone was agitated in the emergency room, let's say, that would get triggered. The pharmacist would see that like conflicting order, and it would prevent the medicine from being like given. It would flag, and they'd reach out to the doctor and they'd say, it's listed as an allergy. I don't know that, can we try an alternative XYZ? So listing them as allergies can be another kind of preventative safety measure if there's certain medicines that your neurologist is saying, I don't know that that would be the best medicine for you to take. We would only take it under very like specific circumstances that are kind of well controlled, and using the allergy function in the medical record can be helpful. Some of that has to be translated from each medical system. So if your specialist is a different medical system, and in the event of an emergency, you go to your local community hospital, you may want to make sure that those translate, and you take your medication list and you go, or your loved one goes through and says, here's the most recent list from my neurologist, here's what I take. Can we make sure your system reflects that, and make sure that these allergies are also captured in the medical record? And then if you're thinking about a surgery or a certain test, maybe constipation is something that you're struggling with, and the doctor's recommending a colonoscopy. Well, if that's something you're struggling with, you may want to talk to the neurologist and say, hey, my primary care doctor is recommending a colonoscopy. And your neurologist may say, okay, I think that makes sense. Like, it's not fun, but I think we want to make sure we rule out anything else that could be going on. But if you're 85 and you haven't had any issues, and your primary care doctor is saying, I think it's important for us to do a colonoscopy, you may talk to your neurologist and say, like, is this really necessary? Do we really need to do this? Because the equation of, benefits versus risks, or, what is worth doing, may shift a little bit over time, both based on symptoms and what's been going on for you, and maybe even your disease progression or some those symptoms as well. And it may or may not make sense to go through some of these tests. Some of the other tests may absolutely make sense. So it's those conversations with the doctor, the sense of like, is this surgery worth it? Does this surgery make sense? Is everybody on board? Do they know that for my Parkinson's disease or my Lewy body dementia or my atypical Parkinsonism, can be a little more sensitive to medication. And so can the anesthesiologist talk to your neurologist ahead of the procedure to make sure that the anesthesiologist understands here are the unique kind of things to keep in mind when making medication decisions or anesthesia decisions. And even then thinking about, after the procedure, when you're talking to the doctor, they may say, yeah, it's an in and out, you'll be out in one day. It's usually just a couple hours in recovery before you're going home. Well, you may talk to your neurologist and they may say, yeah, that's the best case scenario, but sometimes we can be a little more sensitive to medicine. So it's possible that you're out in the day. It's also possible you might need to spend the night. And having those conversations, having a better idea of what's in the realm of normal for someone with a movement disorders, Parkinson's disease, Lewy body, atypical, that then if you do end up having the procedure and end up needing to spend the night, you're not as alarmed because you're like, oh, wow, something went wrong. The doctor said I'd be out in 2 hours, but my loved one needs to spend the night, versus you've had the conversation with the doctor and you have a better idea of what to expect. And you say, okay, this was within the realm of normal of what the doctor said I might be able to expect. And so not ideal, but here we are, and we're still in the realm of normal. And if it's possible, then you need to spend the night, then you pack an extra bag and you leave it in the trunk with a spare change of clothes. And if you have a loved one there, they kind of have a plan for the just in case if we do need to stay the night at the hospital. Or you have a plan of who's going to let the dog out tonight, or, watch my grandkids if my son needs to stay with me tonight. Those kinds of things we can start to make plans for in the event that we need it. Hopefully we're not going to, but it's a little less stressful if we kind of take those into consideration ahead of time. And kind of to this point, I guess I jumped the gun, but is it necessary around the idea of a colonoscopy or other procedures? Thinking about, not all procedures carry the same risk or the same level of benefit over time. And so just continuing to reevaluate sort of that risk benefit, or is it worth it? What am I going to gain from it? And what are the trade-offs? It can be hard sometimes to figure that out. And so having the input of your providers who know you and who know your unique circumstances can be really beneficial. Even heaven forbid you're in the hospital and the care team is recommending, like, I think we need to do this surgery. Well, you could even call your neurologist and say, or your loved one could call the neurologist and say, hey, they're recommending this particular type of procedure over that particular type of procedure. What are your thoughts? Like, I know you're not a general surgeon, but what's your experience between these two things? And your neurologist, again, can kind of help weigh in and potentially inform, do we do A or B? Or even talk to the general surgeon. And that may kind of change the equation between A and B. So thinking about this idea of self-advocacy, but also recognizing that being engaged and involved, that you can say, I don't know that I really want to do this thing. Is this necessary? It's okay to take a pause and ask that. And then navigating some of the challenges, recognizing that, a lot can come up, and that because you're the expert in your experience, you're continuing to have to educate. And that can be really frustrating, having to re-educate, whether it's re-educating the staff on the floor during admission, re-educating the nurses at your doctor's office, because, you need a medicine refilled every 30 days. And you have to call and they have to get this okay before they can release it, or whatever the case may be. And that gets annoying. Is there a way to kind of cut through some of that? Is there a particular nurse in your doctor's office that handles these things, that when you call with this particular question, should you be asking for Judy? Because Judy's the one that processes these. And so rather than going through the main phone tree and doing, all the buttons and then leaving a message and waiting for someone to call you back, and then that person isn't the right person, then they say, okay, I will have Judy call you. Can you just call Judy? Is there a number to reach Judy directly? Or how do you kind of cut through some of that to know, like, for this particular thing, I'll call Judy. She's my girl. She helps me figure this thing out. And because this idea of sort of being collaborative, you're on the same team, you're both working towards the same thing. And there can be these really big systems that make it difficult to move things forward. I work in a large system that can be a challenge sometimes. So I appreciate when people get frustrated that they have to call on like a phone tree main number and they leave a message and then we call them back. That's not ideal. So, thinking about how can we work around that and try to work within the system, but still keep things moving. And so during a hospitalization, if you're concerned that you or your loved one aren't receiving adequate care or the care team isn't being responsive, asking to speak with the nursing supervisor or the social worker on the floor, again, to try to figure out, like, how can we have a reset? How do we figure out, here's what my loved one specifically needs. Here are the places where I'm feeling like those needs are not being adequately addressed. How can we try to move closer together to find a way for us to feel more comfortable that these needs are being addressed? Ask to speak or consider talking to the ombudsman or someone in patient relations at the hospital. Hospitals have these patient relation lines for complaints or kudos. And again, they can be a way to kind of help mediate or navigate some of these challenges that you might be experiencing. Or if you've gone through all these channels and you're feeling like I'm not being heard, I'm not being taken seriously, my loved one's needs are not being adequately addressed, you could also consider requesting a transfer to an outside hospital, whether it's the larger academic medical center or another hospital who's more familiar with your needs or your loved one's needs. And then, also thinking about this idea of like a second opinion. Why might you want one, or when might it be time to think about one? Your symptoms have changed or gotten worse. And it's been more difficult for your provider to manage, or your provider really hasn't been taking them seriously. You're not feeling heard, you're not feeling understood. Or your treating provider has tried what they know to try, and it's seeming like they're outside of their comfort zone, or they've been having limited results, and you're hearing the doctor say, there's nothing else I can do, or I'm not sure what else we can do. And that's kind of the end of the conversation. That might be a reason to think about, getting a second opinion. And you might get a second opinion, and the second opinion might align with what you're currently hearing. You might get a second opinion and it might say, it looks like they've done a lot of the things I would have tried. I have a few other ideas. Like, there's no harm in getting a second opinion, but it can, thinking about it's a brand new doctor. You have to start over again, tell your story, provide all this information. There may be a wait to get an appointment. So like balancing those things and kind of setting some expectations that what are you hoping to get out of a second opinion? Maybe even helping to, again, going back to the beginning of what we talked about, focus the appointment, helping the doctor understand I'm here because of X, Y, and Z, or this is what I really want to focus on today. Thinking about how do you get the most out of that second opinion too. Or thinking about where you can, if you need to go to an outside provider, you may not have access to the specialist locally. And would a second opinion require traveling? And is that feasible for you? Or is it feasible to, what I used to suggest is it feasible to travel once? Maybe there's a doctor a couple hours away that you'd like to try to see, and you could get there one time to establish care. And then after that, you could follow up with video visits. Right now, video visits are set to end Medicare coverage at the end of March. So that may or may not be as feasible right now. We've been encouraging patients who find video visits to be really invaluable to them, especially in the Chicago winter or as mobility gets more challenging to get out, if video visits are important to them, to be speaking up and letting their representatives in Washington know that they want Medicare to continue to cover video visits. They're set to expire at the end of March right now if nothing is done. So that potentially limits the ability to get a second opinion or get a second opinion from geographically like a location that's farther away. So just sort of bearing that in mind about what's feasible. So just sort of thinking about, and I'm happy to share Meredith's slides or whatever would be helpful for the community, but kind of how we can be proactive during our appointments, how we can anticipate some of the unexpected, and be responsive to challenges so that we, again, can get the most out of the appointments, the most from our healthcare team, and ultimately kind of be getting the care that feels like it aligns with what our needs are or wishes are for care. And then at some point, I could talk a little bit about a caregiver study too that I'm a part of. Meredith, I don't know if now is the best time for that or if you want me to save it for later.
Yeah, this is a great time. No,
Okay.
This is a great time. Go ahead.
Okay. I am part of a study here at Rush that is a national study through the National Institute on Health, looking at an intervention specifically designed for care partners whose loved ones have Lewy body dementia or Parkinson's disease with some cognitive changes. You don't have to, your loved one doesn't have to have a formal diagnosis, but they might be showing some symptoms that are causing the doctors to wonder, causing you to wonder, and you're kind of in that process of looking for options or support as a care partner. We know that there are support groups out there. There's lots of information online that's available, but it can be hard to kind of sift through, figure out what makes the most sense or get answers to, is this symptom related to this other thing that we've got going on? So this opportunity is an educational intervention over the course of 12 weeks to look at different ways to support caregivers. And there's a little video I can show if I can get it to go. The study is called Persevere. And okay, I can't get the video to play today. That's okay. But it's specifically designed, it's over the course of, there's a 12-week period of active intervention for care partners, and then there's a follow-up period of an additional 6 months. And care partners, we're enrolling care partners anywhere across the continuum of caregiving. We are part of the caregivers who are earlier on in the journey will be randomized into 2 different education groups. Both groups are getting education specifically for care partners whose loved ones have Parkinson's disease and cognitive changes or Lewy body kind of across that spectrum. They'll all get education. It's just a different intensity of education in a way. And we're trying to look at both what kind of education makes the most sense for care partners, what do they have time for, what feels most useful to them. And it's all self-guided. So it's on your time, what works best for your schedule. There's nothing structured, no calls that you have to be on at Tuesday at 4 p.m. in the afternoon. It's all at your own time, and the surveys and everything you complete on your own time as well. So if you are interested and to see if this is something that might be of benefit to you or something you might qualify for, you can follow the QR code or the link and complete a screening survey, and that kind of goes through, gathers more information and determines if you're eligible, and our study team will follow up with you to, regarding next steps or to answer any questions. But this is right now, and if there's other questions, I'm happy to answer them or talk more about anything that I didn't cover.